Bedside.
Med.
Exam and physician.
Okay.
Physician lead.
Physician
What do we know?
ready for triage report. So patient is a 6-year-old male who was riding in a truck while dad was feeding the cattle. Dad was unaware that patient got out of the truck and rolled a hay bale onto the patient. Dad believes the patient fell on the left side. He was able to roll the hay bale off the patient and call for help. They were unable to obtain an IV on the patient. He has an open fracture to the left forearm, bleeding is controlled with pressure and arm splinted. Reports abdominal pain, last set of vital signs were heart rate of 130, respiratory of 18, blood pressure of 90/64, SATs 96%. Cap refill is 3 seconds. He appears pale. He does have a backboard and C-collar in place.
Perfect. All right. So purposes of the mock trauma, we want to make sure we're using our closed loop communication. We already activated that partial trauma, so good job recognizing the trauma. And then we're going to treat this like a real scenario. It's a safe learning environment. So we'll go ahead and get started.
Alright, so who's gonna be starting my IV?
I will.
You?
That's me. I'll be over here.
Hey guys, what you got?
Alrighty, this is a 6-year-old male who was riding in a truck while his dad was feeding cattle.
You know his name?
Jimmy.
Sam. Sure. Sam, 6-year-old. Dad was unaware that Sam got out of the truck and a rolled bale of hay rolled onto the patient. Dad believes that Sam fell on his left side. Dad
You ready?
got the hay bale off of him, called for help. We were unable to get a PIV. He has an open fracture in his left forearm. Bleeding was controlled with pressure and his arm was splinted. His only report of pain is in his abdomen. Vital signs for us, heart rate is 130, respiratory 18, last blood pressure was 90/64. He's 96% on room air. Cap refill is 3 seconds. He is a little pale. We have a backboard and a C-collar in place.
Sam, can you talk to me? Oral pharynx looks clear, voice is normal.
Clear, voice is normal.
He's got good breath sounds bilaterally.
That sounds bilaterally.
Tachycardic, heart tones are normal.
Heart tone is normal. Tachycardic.
Got 2+ radial pulses.
2+.
Go ahead and get these clothes off. All right, Sam, we're just getting your clothes off. Can we get a blanket on him? Is our room temp all the way up?
Temp should be up.
All right, obvious deformity of his left arm. Bleeding looks controlled. His cap refill on his left fingers are 3 seconds. They do perfuse. He is moving his fingers.
Moving fingers, 3 seconds, cap refill.
Glasgow's 15.
15 GCS.
Pupils are 3 millimeters, equally reactive.
3 millimeters. Reactive, equal.
Right TM is clear. Take a peek in his left.
Right and left clear TMs.
Scalp is intact, no bleeding, no hematomas. Face feels stable.
Hematomas intact.
All right, can we maintain C-spine? I'm going to take this off. All right, Sam, I don't want you to move. I'm just going to take an examination of your neck. No palpable deformities, non-tender C-spine.
Non-tender
Just back
C-spine.
down. His trachea is midline. No jugular venous distension. Breath sounds are still clear. Heart tones. Is anybody working on an IV?
Yeah.
So you get an IV,
Right.
preferably this right arm.
PIV, you're going to try to put a PIV on the right side.
22 in the right AC.
Okay.
No chest crepitus. Chest is stable.
Preface.
Abdomen is a little bit distended. Feels a little tender on the left upper quadrant.
Left upper quadrant.
Pelvis stable. We cut these panties off.
Good thing.
No evidence of any GU trauma.
Okay, GU trauma.
Lower extremity seem good. Right upper extremity's good. Still no active bleeding on this left arm. Alright, we're gonna want to roll him. Let's have you maintain C-spine. I'll have you roll that
Okay.
way. We're gonna get the backboard out at the same time
Okay.
on your count.
1, 2, 3.
No palpable spine deformities. Anybody got any lube?
No spine deformities.
Rectal tone is normal. No gross blood. I would change my gloves right now. Alright, backboard out. Roll back this way on your count.
1, 2, 3.
Alright, did we get that IV in?
Yes.
Alright, let's give a 20 per kilo bolus. Still looks
20 per
tachycardic at
kilo
130. Do we have an approximate weight?
Is, we got a height already. Should we go with
Blue.
20
Okay.
kilos,
20 kilos per weight.
Alright, let's give him 400 normal saline.
94 centimeters.
Let's get a dose of Ansef and gentamicin.
Ansef, gentamicin,
And let's give him 2 milligrams of morphine.
morphine, 2 milligrams.
Bolus
Alright.
started, Laura.
Let's get a chest x-ray.
Radiology's at bedside.
Alright, Sam, you're gonna be fine. Everything's good. You can stop crying.
Hi Sam, we're gonna get a picture of your chest, okay? We're gonna put a plate behind your back. It's gonna be a little bit hard and cold. You're ready?
Nice and comfy, Sam.
Yeah, it'll be just a second, buddy.
Any parents come with him? Do we know any history?
Parents are on their way. There's no past medical history besides ear tubes.
2 milligrams of morphine given.
2 milligrams morphine given.
You want to step out while I take my x-ray? Everybody's clear. Beep.
Alright. Lungs look clear, no obvious pneumothorax, no obvious chest, no obvious rib fractures. Can we get a hold of ortho
Sam, we're gonna take that plate out, okay?
and
There you go.
let's just check hemoglobin on him.
Hemoglobin order.
And he's going to need a CT scan of his abdomen and pelvis with IV contrast. Somebody can get that order in, that'd be great.
Ortho's been paged.
And it looks like our pulse a little bit better, 110 after that fluid bolus. Let's just run him at a maintenance. Let's go with 60 an hour.
16-hour maintenance fluids.
All right, Sam, you're going to be okay. We're going to take a trip down the hallway.
Perfect. All right, guys, good job. So we're gonna go ahead and we will debrief here really quickly. He's gonna go off to CT. And he ended up having a spleen lax, so good job recognizing the need for that. Laura, if you want to lead us through the debriefing. Side one. So as the TNL, here's your debriefing.
Okay.
form.
Actually, before we go over to CT, I would come over here and say, did I forget anything?
No, you did your airway, breathing, circulation, and all of your secondary, just as you should know. You two communicated well together about Chris placing the ID. Christine, thank you for notifying us that ortho was paged.
All right, so we'll just go through this debriefing there, Laura. So do you think there was an appropriate number of staff?
Yeah, I mean, you know, you always like CNA, but yeah,
Perfect.
yeah, I think we were fine in this situation.
Was there a clear team, captain?
Yes,
Perfect. Roles were defined?
yes.
All right. What do you think went well?
Communication. And it was quiet in here, so everybody was listening to one another.
That's what I was gonna say. Perfect, I agree. Anybody else have anything to add about communication?
Everything just seemed really orderly and followed ABCs really well. It's good. Good
Anything-
closed loop.
Anything
repeating.
that didn't go well related to communication?
He didn't have pants on to cut off.
Just panties.
Just
Panties.
panties, yeah. Any red flags that you guys would change or do differently?
No, good team.
Anything from the observer standpoint?
I think it was good recognizing the antibiotics for the open fracture, since that's one of our initiatives this year, is to get antibiotics in within 60 minutes. So I think early recognition was key, so good job on that.
One thing I would
Since it
add.
was just splinted, I was able to assess it without having to take everything down.
Yes.
Is that what you were going for?
What did you ask?
I didn't know if you wanted me to take the whole dressing off to assess.
I think if you can see it,
I think
from
if you
where
can
it's
see
at,
it, it's
then you're
okay.
okay.
Yep.
I could see it.
Yep, if you could see it, then I think that's fine. If you could not see it, then definitely take that splint off. I think one of the things that we could maybe work on for next time is during EMS report, everybody stop and listen to report before shuffling and moving the patient over. That way EMS is understood and there's no miscommunication on what happened.
I thought they gave a little too much information.
Too much report, yeah.
I don't know if they went over 30 seconds. Was anybody timing it?
It was probably close to.
Close to 30 seconds,
Felt like 5 minutes.
yeah. So we will follow up with them. Really
I
good
just
job.
I don't need to know that they're pale. I'm going to be looking at the child, so
Yep.
all of that extraneous stuff. I just want to know the history and what their latest vitals are.
Perfect.
I think it went well.
All right.
Good job, everybody.
Thanks, everybody.
Nailed it on one take.